Hey guys, welcome back to the Dr. Cliff AUD vlog. This is vlog number 36, and today I want to bring you up to speed with what's going on with the build out of the new clinic, and I want to talk a little bit about a video that I posted earlier this week that was really talking about person-centered care. But let's get into the clinic stuff first. So, as many of you know now, because I posted about this about 2 weeks ago or so, we had to hire a new general contractor because our general contractor that we had originally started with had to leave the job. And so we've kind of been scrambling around trying to make sure that this new general contractor is seeing the vision of what we want to do and ultimately carries that out in the way that we want it to be carried out. And so we've spent a lot of time, Ashley and I, really going around to different vendors, because anytime the general contractor, a general contractor leaves and a new one comes in, they tend to work with, different subcontractors, or really the subcontractors that were working with the previous general contractor aren't necessarily going to be wanting to continue on with that job. Whatever the case may be, we've been going around and trying to find some different vendors to help with things like flooring, the countertops, the cabinetry, the electric, all of that stuff. And so we've spent some time finding vendors for those things, and it's kind of exciting because we got to go back and we're kind of changing a few things. The flooring's going to be different, the cabinets are going to be different, the countertops are going to be different, and we've spent a lot more time on it this go around than we did the previous go around. I think we learned our lesson of trying to be a little more hands off, and now we're definitely a little bit more hands on. And I'm probably going to need your guys' help because there are a couple of selections that I want to get your opinion on. And if you're not subscribed to my channel already, please subscribe, because I'm going to be posting an actual post where you guys can basically let me know which flooring option that you like. And we may be doing something with the cabinet colors and stuff like that to see what you guys actually like, and that might sway our decision on which material to go either way. We're trying to keep things reasonably within a budget, which is kind of the next thing that I want to talk about. So when we were starting our build out earlier in 2020, we had a budget of around, I think it was like $290,000, something along those lines. So when we got started, we actually, Ashley and I paid a $10,000 down payment, and then there was an $81,000 draw from our loan for our build out. So a total of $91,000 is basically what we paid to get the clinic up to the where it is right now that I showed you in a video 2 weeks ago on the clinic update video. And we had the new general contractor in and give us a new bid on what the place would cost to get it from where it was at right now all the way to it being finished. And the budget was around, I think, $280,000+. And so I'm like, oh man, I mean, that's just, did we just waste like $80,000 is kind of what I was thinking. And I'm like, no, I mean, we're probably going to end up going with some nicer things. At least we'll make sure that everything's done the right way. But really, at the end of the day, this build out's going to turn into something that's probably around, $400,000 build out, something close to that, maybe a little less than that, as opposed to something that was more close to $300,000. So that's kind of a gut check moment. And Ashley's trying to keep me reeled in and not having me select all of the high-end finishes for the clinic so we can keep it to a relatively respectable level. We still need to talk to the bank and talk about increasing the loan amount to cover all of that. And if we can't do that, then it's going to become a very tricky situation of us having to basically pay for a lot of these things out of pocket. And I don't know if we can afford that, to be quite honest with you. So we'll see what ends up happening. Of course, I'll keep you guys posted on the progress of the clinic going forward. But again, keep your eyes out for some posts on YouTube, which you'll see if you scroll down through your videos, because I'm going to be posting a couple photos there for you guys to select which option you like the best. Okay, so that's it for that. What I want to talk about next actually is the video that I ended up posting this last week. It was on patient-centered care. So I've been working fairly closely with the IDA Institute. The IDA Institute is all about person-centered care. So putting the actual patient at the center of everything that you do, rather than putting yourself as the clinician at the center of everything that you do, or putting, the disease or whatever the ailment is at the center of the focus. And the easiest way that I can equate this, and something that I explained in that video, was this idea of when you go into a medical office of any kind, and you go there and you feel like you're just a number, that they don't care about you as an individual. All they want to know is what your symptoms are, and then they'll prescribe you whatever the appropriate treatment is that's typical to treat that particular symptom, and then they're done with you to a large degree. Well, patient-centered care takes or person-centered care / patient-centered care takes a completely different approach. So that approach is really getting to know the individual, getting to know the patient and what's important to them, and then designing the treatment around those values that patient has and what they want as an outcome. And so it takes a lot more time to do it this way. But I mean, I feel like this is inherently what I've been doing, even since I started grad school working with patients. I always wanted to get to know my patients a little bit better. I wanted to know really what they wanted to accomplish with treatment. I wanted to know what things were most important for them. I wanted to have their main communication partner be involved in the process so I could understand what their perspective is on my patient's hearing loss. And it really leads to what I believe is better treatment outcomes, because I'm making a treatment decision based on what the patient ultimately wants to achieve, rather than just slapping any hearing aid on their ears, amplifying up to prescriptive targets, and sending them on their way. Now, the other aspect of this is that I had received a comment on the channel, and I just want to clarify this. So there was a comment basically saying that this whole patient-centered, person-centered care approach model is a complete contradiction to real ear measurements, which I advocate for. And I can maybe see how this could be a perception of someone after watching that video, but best practices, and real ear measurement is part of best practices. You don't do person-centered care in lieu of best practices. So it's not like you're like, you know what, I'm not going to follow these, procedural things that I need to be following to treat this individual's hearing loss, because I'm so focused on them as an individual, and if they don't want it, I'm not going to do it. I mean, it's really the opposite of that. Patient-centered care means you're putting the patient at the center of the focus, but it doesn't mean that you can't still employ a lot of these, traditional medical things that you would end up doing with the patient. You just have to make sure that you're explaining it to the patient so they can understand. And if the patient says, you know what, I don't want you to do that procedure on me, then that's fine. That's totally fine, actually. If they say, I do not want that, then I don't have to do it, as long as you understand the consequences of us not doing a certain procedure. But at the end of the day, I kind of equate it to someone who would be going through cancer treatments. And I get that this is a completely different subject when we talk about cancer. But there are some individuals where you go and you talk to them. I imagine like an oncologist would talk to these patients and say, okay, here are your treatment options. These are the potential outcomes of those treatment options. And the patient can be like, you know what, even if I, basically pass away earlier, it is not worth it to me to undergo that particular treatment because of how it's going, because of the side effects, because of whatever. It's just not worth it to me to actually go through those medical procedures. And you know what? That's okay, because everybody gets to make a decision on their own. And I often tell my patients that my job is to tell you what your options are, and your jobs are to tell me what you're willing to do. Okay, so I will give you my recommendation, but if someone says, you know what, I don't want to do that recommendation. And you know what? It happens. I mean, I recommend hearing aids for, certain types of hearing losses. And if a patient's like, yeah, I just don't want to do that, I'm not ready for it or whatever, it's like, that's fine. Like, it's your job to tell me what you're willing to do. And it's my job to tell you what the absolute best option to treat your hearing loss is. But this notion that you can't do person-centered care and follow best practices and do different procedural things that we should be doing can't coexist. That's not true. Those things, in fact, have to coexist. In fact, if you read the best practice guidelines, a lot of the components in that initially are to include the patient and their wants and their needs and identify the things that they want and need, and then include their family members too in that entire process, which is a large component of what person-centered care is. So, by me preaching, and I preach a lot about the procedural side of things and the best practice side of things with hearing care, it does not mean that you do that without putting your patient at the center of the focus. And so I really just think that, it's something that was overlooked heavily in my videos. I mean, I think I need to spend more time talking about this patient-centered care aspect of hearing treatment, because at the end of the day, it is the teamwork that happens between the patient and the hearing care provider that leads to the highest outcomes. You can probably get good outcomes by just administering a treatment and not taking into consideration anything that the patient wants, and just look at the audiogram and say, hey, we need to amplify sound to this level. I'm going to verify it with real measurements, and I'm going to, basically I'm going to select the hearing aid without letting you have any input on which one we're going with, and then expect you to do pretty well. I think that that's something that could be done, and in fact is being done. But if you want to receive the highest level of possible care, then patient-centered, person-centered care has to be included in all of the different procedural things that I talk about on my channel. I honestly think that the patient-centered, person-centered care approach, it's technically speaking, it's the biopsychosocial model, is going to replace, to a large degree, the traditional biomedical model, which is, where you go into the doctor's office, all they want to do is see your chart, identify your symptoms, treat the symptoms, right? But I think it's going to end up replacing things. In fact, I did a rant last week on the channel, and I was ranting about insurance and how all of that works. Well, there are a lot of individuals, I'm not talking about hearing care professionals, I'm talking about like medical doctors who are completely getting out of the insurance game, and they're going all private pay, going kind of more of this concierge medicine type thing, because they don't like the aspect of insurance dictating the level of care that they can provide. It's a complete, you get paid based on procedures that you do, and it doesn't reimburse you or pay you for taking time with your patient and actually identifying what's important to them. I mean, it's a complete, 180 to have to let insurance dictate the type of care that you can provide your patient. So what's happening? A lot of these doctors are like, this is not what I got into medicine for. I didn't go into medicine just so I could, prescribe treatments to these patients and not really understand what the problem is, and not really be able to care for my patients. And care is the key word there. Caring is more than just administering some kind of treatment to them, And so I think that we're going to start seeing a lot more of this, where, the providers who really value person-centered care are going to be forced to leave these different insurance groups, because if they want to administer this really high level of care and put their patient at the center of the focus, then they're not going to be able to do it with the insurance reimbursement rates. It's just not going to happen. So I urge you to go back and actually watch that video. I think it was called The Death of the Traditional Model of Hearing Care, something like that, but just a couple videos ago, so make sure you go and check that out. Anyway, I have rambled on enough today. Of course, if you liked the video, go ahead and share it. If you liked it, give it a thumbs up. If you didn't like it, give it a thumbs down and let me know why. Other than that, guys, I will see you next week.